Tate Hayworth welcoming you back to America's Forum. We are talking about the Republican alternative to Obamacare. And before we go any further, Nick, it's important to take a look at what the GOP wants to eliminate from Obamacare.
That's right. There's a series of things that Obamacare calls for, a slew of taxes that the GOP plan would get rid of, including things like the individual mandate, the employer mandate, and a number of taxes on medical device manufacturers, insurance plans, hospitals. Those things would go away. We'd also see the Healthcaregov website go away, which has been an enormous problem.
Make everybody happy.
That's right. And in place of that, there are some other funding schemes that, frankly, a lot of economists have been saying are really a good way to go anyway.
So speaking of funding, how would the GOP's alternative plan be funded?
Well, among the things that the GOP plan would do is it would level the playing field between people who buy insurance on their own and people who get insurance from an employer. Right now, you get a pretty good tax break if you get insurance from your employer. You don't pay taxes on it. Under the GOP plan, you'd pay a bit more for that plan to equalize it to what people would be able to get if they were buying it on its own. Economists have been saying this is a good way to go to fund health insurance anyway, and that's likely to happen.
Okay.
One columnist put it thusly in Washington: Republicans were put on earth for two reasons: to have a strong national defense and to cut taxes. So you mentioned a slight increase in terms of what goes on with insurance cost, but what taxes would come away specifically? What might we see agreement on even maybe in this lame duck session?
Well, the big one that we've really heard everybody talking about, both Republicans and Democrats, is eliminating the medical device manufacturers tax. This is a new tax. It's a 2.3% tax on everything from tongue depressors to defibrillators to pacemakers, and it's been on the books for about 2 years, and the industry says that it's led to the elimination of about 19,000 jobs, and about 42,000 additional jobs in the industry will be going overseas because it's cheaper to manufacture these things overseas. Eliminating that tax would not only bring some of those jobs back and eliminate those job costs, but the truth is that they're not really collecting a lot of money from that tax anyway. It's about $3 billion a year, which is a drop in the bucket. And when you consider that over 10 years, Obamacare is going to cost about $1 trillion to implement, that's a really tiny amount. I think we're probably going to see that one repealed almost right away.
So, Nick, considering the lame duck Congress is unlikely to actually repeal Obamacare until we get a new president in the White House, what is happening with Obamacare? I've heard that the rates are going to go up if you're currently uninsured. What are we seeing right now?
There are really three things to look for. We're in the new enrollment period, Obamacare 2.0. So far, they haven't had the big problems they've had last year, but they've only just begun. The advantage for consumers is you will now be able to kind of window shop without having to commit to a plan. Last year, you had to commit, and then you could window shop. Now you can look and see what your options are. There are more insurance companies that are participating this year than there were last year, but there are also some things that I'm going to recommend you look for. Next year, the cost for not having health insurance doubles. It's going to be at 2% of your salary, so it'll be twice as much as it was in the previous year. Also, January 1, the new employer mandates kick in. For companies with 100 or more employees, they have to provide health insurance for 70% of their full-timers, or they will pay a $2,000 per worker or more tax for not doing so. So my suspicion is that very close after January 1, we're going to see action on both of those things to try to hold those costs down and maybe modify the law to give relief to individual consumers who may not buy their insurance, as well as employers.
A minute remains, Nick. We talked earlier about healthcare.gov, the infamous website. But with this past weekend's introduction of Obamacare 2.0, have there been major problems with the website, or have those been reduced or eliminated?
They haven't. We are not hearing reports of major problems, but part of the reason is that not as many people are showing up as they did last year. You may recall in the early days, the system crashed repeatedly because so many people signed on. There's a people realize they now have until February 15 to sign on, number one. Fewer people are signing up than even the White House is projecting for the year. Earlier this year, there were projections that another 4 or 5 million Americans would. Now we're looking at maybe 1 million more. So the volume online is not as great as it was last year. So far, not so bad.
Fewer people trying to sign up, fewer problems with the website, but still a whole lot of problems with Obamacare. Nick Tate, thanks for checking in with us today, and America's Forum will be back right after this.